All right, so hello, welcome everyone. My name is Alyssa Longi. I'm Fort Peck, Assiniboine, and Sioux. However, I did grow up on the Yakima Reservation located in Washington State. I'm a project manager here at NCUI, and I have experience in both research and in pediatric nursing. And today we're going to be looking at engaging your workforce in healthcare warriors to improve health outcomes through person-centered care. And today I really want you to hone in on the listening part of learning. Next slide, please. So for those who don't already know, NCUI, or the National Council for Urban Indian Health, is the national nonprofit organization devoted to the support and development of quality, accessible, and culturally competent health and public health services for American Indians and Alaska Natives living in urban areas. Next slide, please. So today's presentation will flow with the following format. We had introductions, so I've already introduced myself. I'll have a few opening remarks, objectives, and then a presentation on person-centered care, a moment of reflection, and then an evaluation component to wrap things up. And please don't forget to do the brief survey at the end of the presentation. There'll be a QR code for you to scan. We really appreciate any of your feedback so we know how we can better serve you. Next slide, please. Once again, welcome. Thank you for joining us for this exciting Community of Learning series, which is on a very important topic of person-centered care. We also invite you just to please join us for some of our additional on-demand sessions that will look at health literacy and essential components of communication for person-centered care, and then navigating person-centered team approaches to chronic disease management. Next slide, please. All right, so we have 4 different objectives to try to get through today, including the key elements of person-centered care, identifying what is being done around person-centered care already in Native communities, identifying some strategies to empower patients to be active participants in health decisions, and lastly, to learn how patient or person-centered care model can be an effective strategy in fostering trust between patient, provider, and healthcare systems. Next slide, please. I just wanted to kick us off with a few opening remarks. As a registered nurse myself and just working in healthcare, I know that we're constantly being told new policies, we're being taught new procedures and just new concepts, and we're being put in challenging situations where we don't always have an answer. And so I just wanted to start with a few tips and tricks that I use when I'm learning new information in daily life, but also as a healthcare worker. And so as information is just being flooded towards you, it's really important to listen and pause and reflect. And the reflection is really a key component because it presents us with this opportunity to guide our decision processes and action. We will also take a couple moments of reflection throughout the presentation just to digest what we've learned. Next slide, please. All right, so now we can really get into it. So what is patient-centered care? You may have already heard this term, whether it was in your career or at school or in a job interview, when you work in a healthcare setting, but patient and family-centered care encourages the active collaboration and shared decision-making between patients, families, and providers to design and manage a customized and comprehensive care plan. So in patient care, the patient really contributes to their care plan, and their emotional and mental well-being are top priorities. You can also see the families be involved in this care plan as well. And as you can see from the diagram on the left here, the patient is really at the center of the diagram. And so you might hear the terms person-centered care or patient-centered care getting used interchangeably. However, the literature does support these as being different, with person-centered care really being more focused on the whole person. However, they do both have the patient at the center of the care continuum, which will really be the key point in this presentation today. You might still hear me use them interchangeably through the presentation, but I really just want us to focus on that approach of person-centered care and the person as a whole. Next slide, please. So now how does person-centered care compare to other approaches such as disease-centered? Well, in disease-centered care, the patients are defined by their disease. They can get put into rigid treatment pathways, and they often receive a one-size-fits-all approach based on the lowest cost of care. This can happen when healthcare workers are feeling rushed, or they feel like they don't really have time to consider the patient's or the family's point of view in their treatment plan. This can also arise in a facility when there isn't really a culture or a positive attitude around using person or patient-centered care. While on the other hand, patient or person-centered care treats patients as individuals, relies and builds a strong clinician-patient relationship built on trust and shared decision-making, and gives patients and the provider a voice in their treatment decision. Next slide, please. So while it might seem quicker or more straightforward to just focus on the disease of the patient and treat it in the way that you're used to, rather than really the concerns of the patient outside of their disease-centered approaches often leave patients sick, frustrated, and more apt to need emergency health services, while person-centered care really promotes the patient collaboration, personalized treatment, and integrated and coordinated care, which can result in better health outcomes, satisfied patients, and lower overall costs. Next slide, please. So I also just wanted to take a moment to look at some of the historical context of person-centered care and what this could mean in Native communities. As I was building out this presentation, I sort of realized that we as Native people have actually already been practicing some key elements of person-centered care for generations. And when I was looking at that patient-centered care diagram that I just showed a few slides ago, where the person was in the middle of a circle of different components such as environment and moral aspects, the first thing that actually came to mind to me was the medicine wheel. And you can also think how traditional healing can really incorporate the social, moral, environment, constrictions, and causes of health concern, which are similar concepts that the US have been pushing with the patient-centered care model. Traditional healers also can serve as facilitators to help patients heal themselves, really promoting the patients to be involved in their healing recovery. If we just think of the medicine wheel and then the different, and I do want to recognize and acknowledge that this is unique and can be different and culture specific. However, they do have a fundamental similarity beyond the shape, but also just that alignment and continuous interaction of physical, emotional, mental, and spiritual realities. So if any of that sounds familiar, it's because I've already sort of mentioned it as we've been going through the presentation at really approaching care from a holistic manner. So really just the whole picture, the different elements in the patient's life being balanced to address their concerns and lead to a happy and healthy patient. Next slide, please. And so just a little bit more on the importance of person-centered care in Native communities. It's crucial as in Native communities, we often have a mistrust or a skepticism in medicine and in the healthcare system today. And good person-centered care really helps build that trust between providers and patients, which is crucial among communities who are predisposed to this mistrust. It's also important just to remember that, patients live with their disease 24/7. And so their story can often reveal their problem or what their chief medical complaint is. And then practicing person-centered care is also a great way to just promote self-governance in making decisions in their own health. And then just touching on that family-centered aspect of patient-centered care, which also plays an important role in Native communities as the kinship and the family role is strong and relatives may often be present, particularly with youth and elders when they come into the clinics and for treatment. Next slide, please. So patient-centered care has actually already been circulating in the Indian health system. In 2008, the Indian Health Service launched a patient-centered medical home initiative to help improve the quality of care in its clinics. Next slide, please. So a patient-centered medical home model really encourages patients and their provider team to work closely together to ensure care is more comprehensive, coordinated, and consistent. This graphic here is a great representation of some of the key elements you'll find in a model, which really, as you can see here, highlight just putting patients first. Next slide, please. And so based on the patient-centered medical home model, the IHS care model, which is the model that you see on the screen here, defines the delivery of medical services throughout all stages of care. And as you can tell, and as we've seen throughout the presentation, once again, the patient and the family are at the center of this model as well. Next slide, please. I realize that I've just sort of, flooded you with a bunch of different information and a bunch of models and terms like that. So I just want to take a brief moment to sort of reflect, and then I'm going to do a quick story and you can just relax and listen to what I say. For me, I learn best when I have memories and that I attach to ideas. So as healthcare providers, when a patient comes to us, they're often searching for support or guidance or an answer to a problem regarding their health. So whether you're at a full ambulatory site, outreach and referral, or a behavioral health facility, these people come to us looking for an answer. And so when I tell this story, I just want you to really focus on the listening aspect to our patients when we're trying to find the answer to their chief medical complaint or problem. So a mother, she presented to a facility with her newborn with the concern that her newborn was fussy and that she just wasn't gaining any weight. It was viral season or flu season, and the facility was extremely busy. There were various rest exchanges going back and forth between the doctor, the nurses, the patients. The patients were getting, impatient because they'd just been waiting. And so they finally just decided to refer her to a hospital for further assessment because they couldn't determine what was causing the baby to just not gain any weight. So the hospital was also super busy and overwhelmed, and they just ended up deciding that they needed to admit the infant and her mother inpatient just to do workups and tests to try to figure out what was going on. So the nurse that was admitting the baby and the mother at the time was just sort of following, the protocol that you follow. She began asking some questions, things about allergies, did the baby's weight, etc. And then during this time, the mother just continued to go on about how she was so exhausted all the time, that her baby was crying all day, she wasn't getting sleep. And this comment really sparked something in the nurse to ask a question sort of around the routine at home and just life and feeding schedules. So the nurse had asked the mother, she's like, how often, are you waking up to feed your baby at night? What's your feeding routine at night? And the mother just responded that actually she wasn't waking up to feed the baby, that she was too tired. Her baby wasn't really crying, so she just let her sleep all night. And so for those who don't know, newborns should be feeding around every 3 to 4 hours, at least for those first few weeks. And the answer was actually solved with this one simple question. The baby was likely not gaining weight because it wasn't feeding at night. And just in the chaos of everything, no one really stopped to ask the situation at home or what the routine was. They were looking really for a medical reason as to why this baby wasn't gaining weight. There must be something medically wrong with the baby. And this just resulted in an unnecessary hospital admission, unnecessary tests, and an extended stay at the clinic. Sometimes we might think that we're just too busy to really stop and take a moment to just listen to what's going on in the patient's life. However, this can actually really save us time in the long run. And so I'm just going to pause for a few seconds just to sort of reflect before we move into the next part of the presentation. All right, so before we move on, I just wanted to remind everyone again that the survey evaluation link is on the webinar registration page, and we do really appreciate any of your feedback. It really helps us know how we can improve. Next slide, please. All right, so now that we have a good foundation sort of on what person-centered care is and some of the benefits, a big question is how can we actually begin implementing this in our facilities? Well, there are different strategies you can use. You can use structural strategies, which include, creating a person-centered culture at the facility. This really sets the expectations on the healthcare workers to just approach all their patient interactions this way. There are also motivational mechanisms such as appreciation and encouragement of positive staff work. So if you see one of your staff members using person-centered care approaches in their patient interactions, a good thing to do is just give positive feedback on that and really encourage that behavior. And then there's also process strategies, including promoting communication and respectful, compassionate care. And then lastly, looking at an outcome strategy, which can include just creating empowerment in the patient as well, which also includes just involving the patient in managing their illness and establishing continuous care. You might find yourself with staff members who are approaching their interactions with person-centered care. However, we also need the patients and families to be engaged and involved since it's a team aspect. Next slide, please. So what can we do as healthcare workers to empower our patients to be really involved in their care? A really good step is using active listening. We can just learn so much from our patients by listening to them and showing that we're present, that we're engaged, and that we care what they're having to say. This can really also encourage them to just open up more with us. You can also ask some of the right questions. These can be open-ended questions that leave room for the patient to provide longer, more detailed answers, along with just taking a moment to pause in your busy day and hear their story. Also, if you do have a patient who's opening up or sharing their story, it's important to try your best not to interrupt or cut them off because they may close off or shut down and not share any further. And I do realize that this can be really difficult, as a nurse myself, when you're super busy and you have stuff to do and you're overwhelmed and just patients coming left and right. But even just taking, that brief moment to show that you're present with them can really make a difference. This just really helps build that trust and that connection with the patient. This was actually one of my favorite things when I was working as a nurse. I worked in a pediatric setting, and so I dealt a lot with the children and a lot with the families. And I just felt like each patient and family had a unique story, whether it was behind their health situation or just what was going on at home. And I always felt really privileged to hear them, and it often helped me understand what was going on and why their medical condition was worse than what it was should have been. And then just lastly, really important to remember that Native people are resilient, and we should empower our patients to be involved and take control over their health and treatment plans. And just encouraging the presence of family members and relatives in the care setting, especially for our elders and youth. Next slide, please. So once you're empowering patients, but you also need to empower staff. And person-centered care, it happens in various forms, and it happens at all steps, whether from the moment the receptionist greets the patient, to the medical assistant taking vitals, to the provider, giving diagnoses. Really encouraging just your staff to listen, to learn, and show empathy, and have two-way communication and use eye contact. You might be rushed, but try not to show that you're super rushed. Encourage them to take a holistic approach and consider broader needs and really think beyond the medical setting. This includes emotional, spiritual, mental health, environmental, and social factors, and then medical literacy. Using layman terms, which are terms that aren't too medically complex, when discussing real complex medical terminology, can help ensure that your patient's understanding or following the situation. Be sure to just stop and pause when you're explaining things. You can stop and ask questions and say, was there anything you didn't understand? Do you need me to repeat anything? This is also really important to consider if there are any language barriers present. I do recommend that you watch one of the other episodes in this series where they cover a little bit more about health literacy as an essential component of communication strategies for person-centered care. Next slide, please. So once again, as I mentioned, asking open-ended questions can be a really great strategy just to get your patients to elaborate a bit more and just see what they think and what they're feeling. Some of the questions you can ask include, what do you call your problem? What do you think caused your problem? You can ask, what kind of treatment do you think you should receive? Next slide, please. So there are a range of benefits that I've sort of discussed throughout this presentation that come from using person-centered care models. First, just being that, of course, the person and the family are the center of it, and that it's focusing on the whole person. It's also continuous, and it's a team-based collaborative, which is very essential when you have chronic conditions and multiple medical teams involved. And this is another episode that I recommend watching in this series where they go a little bit more into that. And then just that it's also coordinated and integrated, and it needs to be accessible for all individuals. And all these factors really help contribute to improve patient outcomes, experiences, and trust with providers. Next slide, please. So with all structural changes in organizations and whenever we're trying to implement something, I'm sure we are all familiar that there are different barriers and facilitators when you're trying to roll out that process. One study I found did find that some barriers to implementing person-centered care covered really three main themes, including just the traditional practices and structures, the skeptical, stereotypical attitudes from professionals, and then factors relating to the development of person-centered interventions. Some healthcare workers can probably get stuck on really what is the disease? How can someone's mental or spiritual health have any impact on their asthma or diabetes? So really just training your staff on the benefits of person-centered care to help them understand why it is important to consider all the components of the person and listening to sort of what the patient has to say. And then just looking at some of those facilitators that can help promote and successfully infuse person-centered care at your clinic or organization. There's things like this that could be organizational factors. This could be ensuring that your staff either have adequate support so that they're able to really implement the approaches of person-centered care. Sometimes it can take more time. So you want to make sure that your staff are supported. Leadership and training, that training component, whether it be how to approach the situation or why it's important, and then an enabling attitude and approach by professionals. Next slide, please. So once again, I realize there are various strategies and models to approaching person-centered care. It's not something that's always easy to to do. However, one step that you can always take to really integrate into your facility is empowering your workforce and just engaging them through creating a culture of person-centered care at the facility. This will just sort of set the expectations and make person-centered care more natural and infused into the core patient interactions. At first, it might feel unnatural for healthcare workers to ask some of these other questions, but once it becomes more of a natural process and it's just the expectation, it can help facilitate that. Next slide, please. So before we sort of close out, I did want to just show this quick 2.5-minute episode video from the IHS that helps sort of bring together some of the stuff that I've talked about today. So I will just invite our comms lead to play that for us now.
We've all heard about the cost benefits, advances in quality of care, and improved access to care that the patient-centered medical home model is delivering throughout our nation's healthcare system. IHS launched the Improving Patient Care program to offer tools and resources to implement the patient-centered medical home model throughout Indian health communities. A care model defines the delivery of medical services to a patient or patient population throughout all stages of care. Our internal model and approach to providing patient and family-centered care is the IHS care model. Patient-centered medical home. What precisely do we mean by that? Within the IHS care model, it means improved access to care. A physician-led care team that offers more patients more consistent and reliable access to care. A whole-person approach. Patients receive comprehensive care through all stages of their lives, including acute care, chronic care, preventive services, and end-of-life care. This not only reduces ER visits and hospital admissions, it results in better relationships with patients who stay healthier in between visits. It also means integrated, coordinated care and services that are culturally and linguistically appropriate from the whole team, even the whole medical neighborhood. And the focus on quality and safety ensures that we are continually improving processes and using evidence-based medicine to improve outcomes. Implementation of the IHS care model improves patient outcomes and the patient experience. And it significantly reduces total medical costs for primary care and other services. Since IHS launched the IPC initiative in 2008, participating health programs and facilities are reporting higher levels of patient engagement and satisfaction, and the improved clinical outcomes that go along with those improvements. It's the team approach. The positive relationships among care team members, their patients, and their families, and the positive effect that has on the whole American Indian Alaska Native patient community. Nearly 200 IHS, tribal, and urban health facilities are implementing quality improvement strategies that will lead to PCMH designation. And we're here to make it possible for you to do the same.
Perfect. Thank you for playing that. And we'll only show the first half of the video, but the link to the full YouTube video is at the bottom if you would like to watch the rest of it. Next slide, please. So there are a few key takeaways that I do hope you leave with today, including just really that the patient is at the heart of the care continuum, and the family can also be a part of that. And then person-centered care happens at all stages, and it should of the care process and should take a holistic approach. Person-centered care develops a strong patient-clinician relationship and can improve patient outcomes and experiences. Aim to create person-centered culture at your facility. And then just lastly, to really remember that your patient is a person. So take the time to listen and learn from their story. Next slide, please. So as we close, I want to take one more moment of reflection and just to remind us that as we go throughout our lives and our work days, remember to take the time to listen, pause, and reflect on the information that we're being given. In the context of patient interactions and patient care, the information given to us by the patient or their medical story can really guide our next decision and action we take in their treatment plan and in their medical journey. Next slide, please. All right, so thank you everyone for joining us today. Please take a moment to fill out our brief survey and let us know how we can better serve you. You can scan the QR code on the screen or use your smartphone or mobile device. There's also a link in the registration. Thank you, everyone.